From Quebec west to British Columbia, COVID-19 caseloads are rising at an alarming rate. Provincial governments are under increasing pressure to get tough to prevent the healthcare systems provincially from being stretched beyond their limits. Let us look live at some of the nation's hot zones this morning, starting there in the upper left-hand corner, Montreal, across to Toronto, down to Calgary and over to Vancouver. In all of those centers, healthcare workers are saying it is time to act and bring in tougher restrictions. That's our focus for you this morning, the latest on the coronavirus response nationally. Let's just see how this is translating now onto the map, beginning with the numbers in Quebec. New cases there, over 1,000 every day for over a week, and nearly 600 people in the province in hospital. Ontario broke its daily record again yesterday with more than 1,500 new cases. Manitoba has the country's highest per capita infection rate, nearly 500 new cases yesterday. Saskatchewan, for more than 6 days in a row, more than 100 new cases. It will be announcing new measures at 12:30 Eastern today. Alberta bringing in new restrictions yesterday after 860 new cases. And in British Columbia, again with new modeling showing a doubling of cases every few days. The number yesterday was almost 600. So again, yes, staggering figures and a warning that things could get far worse.
Feeling is that we're only at the beginning of this now. I mean, if you look at the curves, we're on a steep spike up. And even if drastic measures are put into place, it's going to be a while before we see that. So we're really bracing ourselves for things to get much worse.
And that is just one doctor's concern, but she is among many in the province pleading for the Ford government to implement more serious restrictions before the system and the medical services in the province are overwhelmed. The modeling that came out from Ontario yesterday was very much alarming. And let us go to Laura McQuillan as she looks at the numbers and the calls to toughen up.
Heather, yesterday we saw a record-setting number in Ontario, as you showed, 1,575 cases. That modelling showing that by mid-December that could more than quadruple. We're talking about up to 6,500 cases per day, if not more. That's the projection in the modelling released yesterday, looking ahead to mid-December. Now, that is concerning to medical professionals. They are now learning from this modelling within 2 weeks. The hospital system in Ontario could be so burdened that intensive care numbers mean that many surgeries have to be cancelled to ensure there are enough beds and enough staff to look after all those patients. And the co-chair of the Science Advisory Committee that's advising Ontario's government on its response, who released that modelling yesterday, called for restrictions in hotspots, joining his voice to those of other doctors, epidemiologists, urging intervention now, calling for something like the short, sharp lockdown that Manitoba and British Columbia have now put in place for a few weeks to get their numbers down. We have seen resistance over and over from Ontario's Premier Doug Ford towards the idea of another lockdown. And just before that modelling came out yesterday, he was speaking to media, and here's what he had to say ahead of that data being released.
Easy thing to do, folks, is sit back. Let's just shut down the whole province. It's easy for people to say, just shut everything down when they're guaranteed a paycheck every single week. The approach of just saying shut everything down is not the approach we're taking. We're taking a balanced approach. Number one priority is the health and safety. And right beside that is the economy.
Now, will he reconsider in light of that modelling? That is the big question of the day, Heather. He did tell local TV station CP24 that he would meet with his health advisors this morning and get a briefing before announcing any decision. Now we're learning he is set to make an announcement this afternoon alongside his health minister and the province's top doctor, but we don't have any details at this point on what that will be.
Other than the time, we know it's 2:30 this afternoon, Laura. So yes, we will be paying very close attention to see if that is related to that meeting set for this morning. One of the aspects that we've been looking on an ongoing basis is gathering and capacity limits, size limits. What is the latest thinking there?
So when it comes to gathering limits, there have been difficulties for provinces to keep these, well, really enforce them. You can have gathering limits, you can have fines. How do you stop people gathering at their houses? And that's where the circuit breaker idea comes in. And just a short time ago, when you spoke to infection control epidemiologist, Dr. Colin Furness, what he was speaking about on the front of having some kind of a circuit breaker in Ontario is not just the difficulty of rolling this out, but getting people to follow it after the mixed messaging we have been seeing from the province of Ontario for weeks now. I want to play you a clip that stood out to me from him.
Everyone stays home, go out once a week for groceries, that's it. Very unpleasant. And what would happen is in the first 2 weeks, cases would actually go up because we have a lot of undetected cases out there. A lot of people who have COVID who don't know, lock them up with their families and they'll make everyone in their house sick. So cases go up, and then by the third week, they might start to come back down again. And at that point, we would have interrupted transmission and we could see things settle down. This hasn't worked very well in very many places because you need heavy compliance.
Heavy compliance or heavy enforcement. What you're looking at there is Quebec City back in September, because Quebec actually gave its police more powers to enforce these gathering restrictions. But in other parts of the country, like Manitoba, currently in a circuit breaker, it has said its ban on going to other people's houses or having them to yours isn't really a ban. It concedes that it's only a recommendation because it cannot enforce it. So that would be a challenge in Ontario as well if it were to crack down on gathering sizes. A lot of people wondering, Heather, will it do that in the lead up to Christmas? Because of course, what happens between now and then and going forward is going to really impact how the numbers look in the months ahead. We're only looking at mid-December right now.
Plans could end up being in flux and affected again by this. Laura, thank you very much. Laura McQuillan, starting with the Ontario scene.